and welcome to PNR 204 Pediatric Nursing. I am Professor Bogart, and I am here to help guide you through and make you probably get a better understanding and a better love, actually, of pediatrics. You know, I came into pediatric nursing back in the 1990s. I did it in the 80s for a while, and then I came more full-time in the 1990s. I have done ER, I have done newborn ICU, pediatric ICU. I have done, and my favorite is cardiac ICU. I live in South Florida. I live in Miami. Actually, a little bit lower. It's called Homestead, and it's a little bit more country and not as much as developed. Although, boy, there's a housing boom down here right now. I live about a mile and a half from the beach, and I've got a pool in my backyard. So I am really South Florida girl here. Been here since 1980, so a really, really long time. Actually, I got my degrees and I moved out of small town New York, and it was small town New York. And I moved down here to Miami, and I've been here ever since, and I've really enjoyed it. I'm married. I've got two boys, a boy and a girl, and I've got three step daughters. I am with my husband now for about 20 years. Very happy. And you're going to hear me reflect in a lot of stuff that I do about my grandchild. I've got a 6-year-old that I really had a really good opportunity for the first couple years of his life. He lived with me, with my daughter. And it was rewarding to see a child from a grandmother's perspective and that close. And I've got to look at all the stuff I teach and to see how it's in there. So you're going to hear about Christian all the time. And I'm sure I'm going to hear about some of your children and what some of you has been doing, seeing if they're where they should be. Now, I have been with Fortis College since 2017. I decided late in life to go back to school. I had an associate degree up till 2009. I went back, got my BSN, my MSN, and I'm almost done with a PhD. And my PhD dissertation is a pediatric one. It's school-age children's attitude and behaviors towards injections. How many of you have kids that are afraid of shots? Get them away from me, right? And some that aren't. And I think that children who are afraid of injections, whether it's stitches, shots, IVs, blood draws, whatever it is, they become adults that are afraid. And what happens is they're not going to go get immunizations when they're available, right? And then what happens? All these disease preventable things are now becoming more rampant because there is this needle phobia that now is transferred into the adults. So if we can catch them as kids, we're going to have more people, more compliant, making sure that they're protecting not only themselves, but the population. So I have worked in pediatrics, and I also have worked in pharmacology. It was one of the first classes I taught. They said, all right, we have peds. Okay, I could teach that. But can you teach pharmacology? And I said, well, I guess I could fake that. So little did I know that pharmacology was a little bit more than what I thought, but I learned it really well. I also learned a way to do dosage calc that makes sense. I'm an extremely logical person, and you'll understand that by the way I teach. I make it logical and understandable. I don't teach you big words. I teach you what those words mean and how to apply it and what to look for. Okay?
Is
So
it, will we be able to like meet with you for math since you're like so good at it?
absolutely,
Okay.
absolutely. I do have one session already planned for next week, Friday at 6:30. I have 3 students coming if you want to join that, which would be right after class or any other time during the week. All you need to do, send me a message. Now, all I request is I will send you 2 recordings and 4 worksheets. Start working on them. And then when you get to me, you know exactly where you're weak and the questions you need help with. And I can help you get that block out and make you say, oh, now I get it. I've had students go from all math questions wrong to all math questions right by the end of my tutoring. So that's my goal for everybody. There's no reason to give any of those points back on any exam in any course, okay? So how do I teach? Well, today you're going to get that orientation PowerPoint because I need to go over the rules and things that are going on. And then the second thing we're going to do is go over the PowerPoint of today's information. What are we doing today? We're going to be going over the growth and development and nutrition. We're going to go over infant and we're going to go over the toddler. So that will be a PowerPoint. And then what I do is I will follow it up with a Kahoots. Now, I've started making Kahoots, and these Kahoots will reflect on quizzes, exams, and HESIs. I go back and look at all sorts of test questions you might get, look at the concepts, and I make up questions. All right, or I find a question somewhere that might be, but mostly I make a lot of them up. And it will make you think about the concept in the question. And as I do the Kahoots, I'm going to describe what are these concepts to try to get you thinking, okay? So any questions so far? Let's go ahead and start. And are a lot of you in community already? And you've already done your first PowerPoint that they give to you?
Yes.
Okay, well, I'm going to go over some of it. Some of those stuff that I consider really important. But this is the information on this course, and what you're responsible for doing, what I'm responsible for, and how I'm going to help you succeed, because my goal is for everyone to pass this course. That is my goal. And the way I do that is I'll reach out to you. Do you need help? If you say yes, bring a time, come back to see me, and we'll work together. Okay? I do not mind spending time and helping you. So we know online is a little different, but just think of it. You've gone to school, you're at a class, and I'm the teacher in the front on the podium teaching, but you've got all those backgrounds at home, right? You've got little kids that need to be fed. You've got kids who want you, teenagers that, of course, have to talk to you right now. I understand all of that. Now, how do you get what you need? Well, number one, contact me. If you can't get a hold of me, we also have a brand new lead pediatric professor for the PN, and that is Professor Stiles. And I'll put her information in our first announcement that I send to you with the recordings from today. Okay? Now, if you can't get hold of her or me, which will be very unusual because I'm usually on the phone till about 10 o'clock night looking to see if there was any questions before I go to bed. I stop looking, of course. But let's say you need something, or you don't like what's been done, or you're just, whatever. Please contact my boss. My boss is Dr. Brown. This is her phone number and her email. I am not offended. I'm not taking it out on you. I won't be upset. If you have something that you need and I'm not doing it for you, I want you to go to my boss and find it out, okay? I don't get yelled at. I just will then be able to improve myself more, okay? I want to be the best I can be for you. So I would write this phone number down, stick it in your phone. It's 720-665-6101. And that's Dr. Brown. Now, that's not her cell phone, but I'm telling you, she answers it pretty quickly. And even emails she gets back with pretty quickly. I don't think the woman sleeps at all. I could talk to her, and she lives in Phoenix. So she's 3 hours before me. So at 7 in the morning, my time, which is 4 in the morning for her, she'll answer the phone. So I can also call her at my time at 12 o'clock, 1 in the morning, and it's like 10, 11 at night. She's still answering the phone. So she's there, she's available, and she's very approachable, okay? So again, if you have any problems, contact me. Now, if it's something to do with, computer, internet, things going on, please try to send something that I have a timestamp for. That's in Canvas, okay? Excuse me. If for some reason you can't do Canvas, send me a message. And again, it's a timestamp. This is the time I noticed this is going on. I can't, whatever. And now I can prove that you notified me before something's due, right? Or if it's during an exam and your computer crashes, I know right then and there. And I can look at things in the computer and I can prove it. And it's there to help you. I'm here to fight for you and for your rights, okay? All I want you to be is be respectful, be professional. I'm Professor Bogart or Professor. You could call me either or. That's what I like to be called. And, as we're, when we're teaching, make sure you put your hand up or wait for me to call on you. And it's just respect for all of us. It's just making me mindful of all of us, okay? And that's what that says. Class starts at 3 o'clock Eastern time. And if you are 3:01, you will get 15 minutes off your time for attendance, just to let you know. Okay. Again, if you sign out early, same thing. And those little 15 minutes can catch up. Now, we know that today attendance is looked at. They're going to be looking at 5, 10, 15, 20% absence, and they're going to be sending you messages. And if you get to 20%, they will, unless it's somehow excused, will take a letter grade off of you. So instead of an A, you get a B a C. If you're just passing, no, now you have a D. So if you're going to be absent, let me know before. That's number one. And then if you go to a doctor or if it's hailing and your internet's out and you can't connect, send me a notice from the electric company, because usually you'll get those, or get one from the building that the internet went out. All of those little things can save you. So be aware, communicate with me, and I'll tell you what we need, okay? Because I don't want you to get any grades pulled off or anything. So I know how to take care of it, and I will help you, all right? Remember, the syllabus is the Bible. I think you just saw that when we're looking at the math. Now, we've always done math, and I didn't look at the syllabus that closely, apparently. And I said, well, where is it? Well, it's not there. So that means, no, it is not due. You don't have to do it. But it's sort of good to review math. Now, as again, I'm going to send you my stuff, and I would actually prefer you to do that, and then we can work together. I don't want anybody to get points off because of math. Now, late work. Excuse me. Now, homework is due on Sunday nights at 11:59 Pacific time. That means if you're in Eastern time, that's 2:59 a.m., okay, for Eastern people. So it's a little bit leeway, especially those who work night shift. I worked night shift for 23 years. I love night shift. Now, if you can't get it in, if you notify me before it's due, not at 11 o'clock at night, but earlier would be better. Even the same day is okay. My children have been sick. I have been sick. This happened, that happened. And I can give you some grace time to get it in without a deduction. But again, you tell me after it's due, I will not, cannot. It's just part of you communicating like you would communicate to a doctor. This is going wrong with my patient. So this is the assessment. Your assessment in this case is my kid's been sick, I haven't slept, and I'm getting sick now and I'm not getting the homework done. Can I have a couple days? That is that assessment, okay? So you haven't notified me and it's the second week. I will accept something one more week after it's due only, and it will be a 10% deduction. After it is 2 weeks late, it is a 0. Unless, again, we've had communication. What if you've been in the hospital, you had emergency surgery, you couldn't get to it? I've had many people, like last semester, my brother died, at the end of class, and I had to hang up on everybody right away. I mean, things happen, and I understand that, and we'll expand it. But again, I need to know before, okay? And I will work with you, and Dr. Brown will too. Now, attendance is not only you coming to class. When you're online, they also say you have to go into Canvas 2 times. This week, you're going to go in and do your initial discussion question. Plus, you've done the syllabus quiz, you've done your other initial discussion, and then the responses. You're in there, more than that. So many of you do like to work ahead. I would sort of warn you against it to make sure that every week, 2 times, you've posted, done something in there, okay? Very important. The thing about this, and you're not getting stuff in Canvas, if after 14 days, you're not posting the way that you should, without notice, without telling you, without explanation, even if you come into class, they can drop you. All right? So be aware of that. So make sure. Now, I send messages. Hey, you didn't get this done. You didn't get that done. I mean, this week there might be a student that was in another class who came to this class and it didn't get transferred when you switch classes. Okay? Let me know so I know those things and I won't hold it against you. So again, I think you're hearing communication, right? Attendance is on Zoom when you come in. I look at it again, 1 minute is 15 minutes. So if you come in and it's by military time, so at 15:01, you are late and get 15 minutes off. If you're here at 1500, which is 3 o'clock, guess what? You're on time, not a problem. I do come to class 10 to 15 minutes early, just for those students who need to talk. So some of those who might need some insight, or there's a concept, or, want to talk about something. Whatever it is, I'm here earlier if you want. I usually start at 2 minutes after. And the reason why 2 minutes, sometimes the computer all of a sudden needs all of a sudden an update. You weren't expecting it, or the internet's taking longer. So I understand you all are busy, you working, you've got children, you've got a life, and you're going to school full time. And it is rough. And I know it's the last moment. You're trying to grab a snack and trying to open the computer all at the same time. And I know that. So that's why I always do about 2 minutes late. I've already talked about the 20% and all the time missing. I think you understand. I will give you, as you noticed, what is due for this week. So it is not math. It's just that introduction discussion and then the discussion question, which is on theorists. I did give you a handout, the theorist PowerPoint, something for you to look at. It also has some growth and development in the end, but I liked what it says about Erickson and Piaget, etc. I'm going to go over them too. I'm going to try to make sense of them. But what I've read so far, and some of you've done really well. So they're pretty good. There are a lot of things, 20% that is your homework stuff. Make sure you get them in. There are a lot of points. Your case studies, those are 5 points. Just the practice and an assignment exam in the end. CJ Sims is 10% for only 2. NCLEX question is 5. So make sure that you do get them done. And again, on Saturday or Sunday, I'm going to send you a message. Hey, I don't see them. Please get them in. And then if there's something going on in your life, you can say, oh, I'm sorry, professor. I was in the hospital, or my dad or my mom or grandma or kid or whatever's going on. Let me know. Again, when you are doing this course, your biggest, most important thing is to keep ahead of the work. Don't fall behind. Whatever it does, however you do it on your phone, you put a calendar, what's due, or you have a paper that you write it, whatever it is, make sure that you do have something to keep you organized. I try to keep you organized by, I don't send a lot of announcements. I don't send 5 announcements a week, minimum of 2. And what you'll see is week 1 information. It'll have your PowerPoint, what we're studying, what is due, or any other handout I'm giving you. And then the second one will be later on tonight, which will be week 1 recordings. I will attach the PowerPoint again, so it's in one place, okay? All the attachments, no, but the PowerPoint, yes. And it will have your recording, and it will also have your Kahoots that was done that day, because that's the one question. Where was the Kahoots? Where can I find the Kahoots? Well, number one, it will be attached with the recordings after class. Make sure that you have your syllabus printed. Make sure that you've gone in and signed in your book. I think there was one more person left. And your book is a good book. It's actually very easy reading. And actually, I like the PN book better than the RN book. I think it flows a lot better. And again, if I'm teaching something you're not understanding, you've looked at the PowerPoints, you've looked at the Kahoots, looked at the concept, you still don't get it, your book is your Bible. Remember that. Try to come to class prepared. Try to look at the information. Now, quizzes are done in the beginning of class. And next week, the first quiz will be on this week's information. I don't give you that you come to work prepared and then I teach you that. I want you to go back and look at what we've already learned. And there is no math on the quizzes. Those are some questions that were big ones for some of the students here. My office hours are all the time, as in call me up, send me a message, let me know you need help with, like somebody asked for math. Send me a message. We'll find a date and a time that works. I don't need 2 hours of your time. I mean, 30 minutes, I can get a lot done, or even 15-minute increments. I'll work with what you can give me, okay? So don't be afraid that I'm going to get a hold of you and not let you go. I don't do that. I understand. I'm just finishing a PhD. I was working full time. I was teaching, doing clinicals. I was, completing a PhD with all of these things that had to be done. Family, full time, and I have rheumatoid arthritis, which is infusions and this and that. So I know what it's like to be busy. I know what time is. I know how important every minute of the day is. Now, during class, when you come, if this is the time that you have to eat your lunch or your breakfast, I don't mind. I don't mind you have something to drink. I don't mind if you have something to eat. That does not bother me. Now, I have a question for all of you. We are 2 hours and 45 minutes long. That extra 15 minutes is to make up for the Friday after Thanksgiving, so you don't have to attend another class that week. And I think that's pretty reasonable. Now, you get 10 minutes per hour as a break. So let's say it's 10 minutes, and it's 45 minutes. Let's say we have another 5. So 25 minutes is break. Now, I can give you a break, or I can go straight through and then get you out early, about 20 after 5, instead of keeping you all the way till 5:45. What do you want to do? Now, you can run to the bathroom. You don't have to tell me. You could get up, get something, just come right back as soon as you're done. I don't mind that. What do you want to do?
Straight through. I vote straight through.
Who else?
Same.
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 Okay. All right. I mean, most students do. I don't mind. I have my glass of water right here. I'm ready. I'll just keep going. If I have to get up, I'm going to say, oops, give me 2 minutes. But usually I'm okay. All right. There was one student who was really concerned about that. So I wanted to make sure that was taken care of. All my classes go straight through. And, between the PowerPoint and the Kahoots, there's a couple of minutes there. You have a time if you need to, and you're not going to miss anything. Now, I don't do per se weekly review sessions. As I said, I do them as you need them. Let me know. I will work with you. I don't mind. I do evenings. I do afternoons. I do not like early mornings. I'll let you know that. But I'll do late mornings. I'll do afternoons. And I'll even work into the evenings to help you to work in your schedules. Okay. So grading, the most important thing. How am I going to get graded? Well, KGA is like, what is that? It's called Key Graded Assignments. This is what makes your 78.0. Exams, quizzes, and HESI. They have to equal 78.0 to pass the class. Then we add in all of your homework, which is CJ Sims and NCLEX, those PN assessment practice exams, and your discussion questions, okay? That is added in when we're done. Be careful. Homework will fail you if you do not do it. I had one last quarter that they ended up not doing enough of it, and they failed by a minuscule, but they failed. And that breaks my heart because I went back and counted the amount of times that I had messaged her, and it was 20 times. So I had tried really hard to let this person know. It's not that all of a sudden it's going to happen to you and you're not going to know. You will. I will be very verbal. I even will be getting your phone numbers. I'll text you if I need to, but rarely do I text and bother you that way. It's usually done on Canvas and messaging, okay? Now, we do turn those homework grades on and off for the reason of the homework, okay? To show you how it does affect your scores. Now, most of you, it brings your grades up, right? Because you do them because you want to take that 78 and make it a B. I mean, if I was a student, I would be doing that to make sure that I knew that I was going to get a B. I don't know, it was better than a C, right? So for the first 5 weeks, they're off. All you're going to see is exams and quizzes because we know the HESI's not till week 11. Now, on week 8, I turn them off. And that's drop week. So you sort of know where you are at that point. I mean, I tried not to get you to the point where you have to drop. Hopefully before that, you've worked with me. We've taken, exam 2, we've turned you around and you're doing well. So if you work with me, you should be able to get through this course, okay? I've been teaching PNs now since the beginning of this year, and I absolutely love teaching the PN student. I think you guys are amazing overall, and you are a pleasure to work with. So whatever you need, just ask for me, okay? Now, the homework grades aren't turned on till after we get all those key graded assignments in, right? So now you have the exams, you have your quizzes, and now you have your HESI. It equals 78. Well, then after all and everybody remediates, then it will turn on the homework of grades, and that will be your final score, your final grade, okay? And your HESIs are not entered in a grade book until remediation is done. And we'll talk more about that when we get there. So I've already talked about all of this. Quizzes, beginning of class. Anybody with accommodations, I need to know before next week so I can give you accommodations on your first quiz. If you are with accommodations, we have to figure out how and when are we going to be giving you your exams? Are we going to do it in class, start early? Are we going to give it after class, another day? Let's see what we need to do, which works best for you. I don't want you stressed. That's my point. To come to class, to take an exam, to be all stressed out doesn't do you any good, and it's not going to reflect on what you really know, okay? Quizzes are beginning of the class. There's 5 of them. They are new. Every single one that's coming out is new. You have 1.5 minutes per question or 15 minutes. You can only go forward. You can't go back. And once you're done, you'll get your grade, but you won't go over what those questions were. Anyone who wants to review their quizzes, this is Friday class. Actually, there is one class after us, so we can't give out, what those questions were. But anyone who wants to go over, what did I miss? What were those questions? What were the concepts? Let me know. We can come to class a little bit early next week, right? And I can let you know. Exam soft, we give our, which is exemplify. We're going to be giving our exams. Come to class, nothing on your head, no hats, no bonnets, no headbands, nothing in your ears. If they're ear plugs, I need to see that they're just sound noise, stopping the sound. Also looking at your area, making sure your watch is not an iPhone watch, all that stuff. And it's to keep you safe that you are taking your exam, that you're taking your exam, all right? Because remember, in the end, if you cheat, and I understand it's hard and you want to get through it, and it's sort of should I or shouldn't I? Just remember, when you take your NCLEX, you can't cheat. And all you're doing is cheating yourself as you go through, okay? And if you need help, I'm here to help you. Take my brain, pick my brain. I'm here to make you understand. Exams are one attempt. I've had students on question 15, all of a sudden their screens went black and they couldn't get back in. What do? Don't worry. Don't stress. You're going to send me a message immediately and we will arrange it to be done at another time and we can pick up from where you started from. It's not lost. If you do your exam, it doesn't download right away. It's still there till a week or two later until I have like the, get rid of the exam things, which is usually at least 2-3 weeks after the exam is given. Don't be like, oh my God, I'm not going to get the exam. And, don't worry. It's still going to be there. And we can recontinue there and I'll work with you. I can see this stuff, but your job again is communication with me. Exams are in class time. There are some students and some campuses that notoriously like to have somebody on campus do their proctoring. Now, I don't notify anyone. The campus person needs to notify me. And if they don't notify me, they're not going to be able to get in because they won't have an access code. And it should be right around class time. A lot of times they do it a little bit before class time to get it done. But remember, class will still be held after the exam. So you are a 3 o'clock class. I usually say if you are taking your exam, proctored it somewhere else, or you have accommodations, you have other things you're doing, come back for class at 4:20 p.m. Eastern time, and then you will get class because I still will lecture. Okay? So just to let you know those things. And as you're trying to do it, I'll remind you again. But remember, there's always a class after an exam. Make sure you have your ID and make sure it's either, your driver's license or if it's, the school ID. Missing exam. You don't call me, don't notify me, you don't show up, you're going to have a minus 10% deduction. If after 1 week I still haven't heard from you, it will be a 0. So again, you're here over and over again. You need to tell me what's going on. I can help you. All right. And if I don't remember, say, oh, remember I told you? Oh, okay. Yes, I do. Remember, I'm a little older, so sometimes I have moments on clarity, but I will make sure that you are treated fairly. And what I've said, that's what you will get. Okay. Just to let you know. If you have to miss an exam, something's going on. I had one student already notify me they have surgery scheduled for that date. That's been scheduled for months. They can't change it. Just send me the copy of the medical stuff and then we could change it. We could either do it before or after when you're cleared by your physician to come back to work, to school, okay? Every missed exam, unless there's some other circumstances, must be done before the next class. So you're a Friday class. You must have your exam done before Friday next week, okay? Before class starts. Again, always tell me before, don't tell me after. Make sure that you have yourself organized. Yes, I'm going to tell you what to do. Yes, I'm going to send you reminders, but make sure you keep everything organized. I mean, I have one of those big calendars and I write on it for myself because that's the way I work. I'm sure many of you have it in your programs, in your phones, and your calendars, and you can check off as you go. Whatever way works for you, just keep yourself organized because about week 7, week 8, it's all going to flow into each other. Trust me. And you're going to like, did I do this? Did I that? I don't know. Cross things out as you go, whichever works. Okay. Again, late work, we know about that. Talking to me is important. NCLEX questions. The thing about NCLEX questions, make sure you're doing the areas that I'm requesting, and that's in the modules. The modules will tell you. I don't mind if you do NCLEX questions early. Just be careful with posting them, okay? NCLEX questions are open for that purpose, or you can save them and put them in later, all right? You can do that. When you turn them in, it must be done not by that little green square thing. I want that 6-page, 4-page, whatever printout so I can go and I can look at the areas you did. If you do not give me the proper way of turning them in the first time, I'll put a 0. No, you're not going to get a 0. What that's telling you is, ooh, I need to go check. Go to the page and I will have as a message instructions on how to do the NCLEX questions the way you should. And if you need help beyond that, takes me 5 minutes. I can show you through on a Zoom quick, and so that you could be turning them in correctly. And this is for any online course. So if you have problems, let me know. I can help you. And I suggest minimum score, get your 78. I mean, many of you get your hundreds, but remember, this is added in the end, and you can fail if you give me all 50s, instead of hundreds on your NCLEX. It is 5% of your grade, okay? CJ Sims, something that was new, added last quarter, and I really like them. You only have 2, and all you need to do is there's a screenshot that you need to send in the end, and it'll have your name and it'll have your percentage. And all you need to do is send me that. It shows me your score and it has your name and it has your date. And then I'll put them in. Each CJ Sims is 5%. It's big, so make sure that they're done. Those the assignment and the practice exams, 5% total. They're at the end of the course. Make sure that you go in through the modules, get them done, 1 attempt, okay? Now, these you must do as they're said. You can't do them early. And if you see that you've done them and the scores don't go over into Canvas, let me know. There's ways I can look to see if I can see it, or I will tell you, please fill out a help ticket, okay? So I can work. There's things I can see. What else we got? Discussion posts. Now, this is what I'm seeing already because I've looked through some of them already. Make sure that you have a reference when you're talking about information. The other thing is during the paper, as you're writing it, where did you get that information from? If you have one reference, it's easy. Maybe it's just the book. In parentheses, Leifer, comma, 2023 should be at the end of a sentence in each paragraph. And now that's showing me what we call a citation. That's showing me that information is not me, it's in the book, and that's from this book, okay? If you need help with it, let me know, because it will be, if you do everything right and you don't put a citation, instead of 20 points, you get 18, just to let you know. So try to get the newer information for it. And it just gives you the most up-to-date practice because practice changes a lot, like we were talking earlier with one of the students. The quiz is in your module, so it'll be opening up at 3 o'clock when I say so. Don't go in earlier. It is only open. It must be proctored on Zoom. I must be there watching you, or it will be a 0, okay? So be careful. And I can see when you start. There's all sorts of timestamps in there, just to let you know, whether it's me or any other class, we can see when you start and how many times you click something. If you're having, and I've mentioned it several times, something happens, your computer battery died, it went black, all of a sudden it started rebooting, that happens, immediately stop. Don't worry about it. I'll take care of you. You'll be able to do it again, but send me a message immediately. Sending me that message, it gives me a time, and I can refer to the time on your exam. And that exam, it'll say, okay, let me get her and let her redo these things. Don't try to get yourself frustrated, stressed out, trying to get these up and running again, okay? Because that will make you not think right. And I don't want you to lose any points because you are stressed. HESI exam is on week 11. Most of you will have it done on campus. I have no input into the date or time of them. I could just tell you from previous history, they usually do it around the same day as your class. So probably on Friday. Excuse me, that they will have your HESI scheduled for. I do have a HESI handout that I give. I've got a HESI Cahoots. And what I do every quarter is at the end of this quarter, they have the HESIs. And there's reports that come out with it. And you've seen them. You have your own reports for each exam. I can see the questions, the concepts. I have no clue the questions. I've never seen a HESI. So I don't know questions, but I know, let's say it's a concept that talks about a Pavlik harness. Well, what might be a question that might have? And I have said, all right, that question, many students got wrong. I will make sure that when I redo again, because I do it every quarter, I'll redo the HESI review again, and I will make sure that the areas that were weak are covered, okay? I've also taken your NCLEX PN book, your Saunders, where it has all of your subjects. I've gone to the pediatric area and made about, I think it's 85 slides on all the concepts in there, and all the HESI hints are in there. It is a great review to go over for your HESI, okay? So I've worked really hard for you to get everything you need in order to have the best grades. And what I did see this quarter, the grades were a lot better because I started it this past quarter, okay? And again, I'm going to be updating it some more so I can even foresee even better grades for you. So I know HESIs, you're like, I don't do good at HESIs. Well, we're going to make sure that we get your grades back up there. Remediation, you've just come off doing a whole bunch of them. We know that they are due on Monday night or Tuesday 1 a.m. They're due before I wake up on Tuesday and look through all the scores and the remediation. Again, your remediation isn't there, you're going to be hearing from me. I'll be sending you messages. Because if you don't do remediation, you get a 0. And I don't want anyone for any reason to get a 0. So part of these questions here are telling you, how do you relate education, teaching to being a nurse? And we know that if you're no communication, or if you do something without communicating, these are things that could have problems on your patients. So basically, that's all that says there. So any questions about all the things and rules and whatever? I think overwhelming you here, talk to me, communicate with me. I'm here to help you. If I don't know, though, I can't help. All right, let's go to our first PowerPoint. It's quite lengthy. but it's got a lot of information in it. Be aware, I don't read slides. I tell you the concepts about slides, okay? So let's try to make this a lot more fun than just looking at it. Well, this first picture I absolutely love. Think about an infant. They're born how? 7 pounds, and they can't even lift their heads, can they? And by 1 year old, what are they doing? A lot of them are walking and eating and talking, right? Throwing things at you. So 1 year growth and development in an infant is quite amazing and remarkable. We know that children are in this constantly growing. I mean, adults, you're already there. And then you have to just take care of what you're left with after you grow, right? A child is always growing. And I call it, it's a step stairs. You grow and then you level out. And I call the younger children, they get a little pudgier. Then they grow and slim out and they get a little pudgier, right? And this goes for everything when you talk about children. And we can see it. Oh, just about to have another growth spurt. Look at those pudgy cheeks, right? Now, developmental needs are things when we're doing assessment on children are really important. We know that if a child isn't doing certain things by a certain time, there's something wrong and we need to do something to correct it. Let me give you an example. Well, usually by 6 months, an infant should be able to go from his belly, turn over to its back, and go from the back and go over to its belly. They're rolling, in other words. Well, what if they can't even roll from their easiest one, belly to back, and it's 6 months? They're developmentally behind, right? What do we need to do? Well, we tell the doctor and we have what we call early intervention. And usually that's speech therapy for older kids, physical therapy, occupational therapy. And you know what's great about kids? They catch up really, really quickly. You start to teach them, make it fun. These children, they're going to catch up, and it's like they never were behind, okay? One thing in children that we do, unlike adults, I don't know the last time a doctor weighed me in his office, but children, what do? Get on the scale and see how tall you are. Do you ever wonder why we do that every visit? Either it's in the doctor's office, the ER, the urgent care. It's because we're trying to see, are you getting proper nutrition? Are you eating properly? Also, there's many like hormones, metabolic things, your thyroid, your growth hormones, all of these things, the pituitary gland, et cetera, are all secreting this stuff to make us grow. And what if we're not? So it will make us start looking for stuff quicker than waiting till other stuff happens. Just height and weight is one of the most important things that we can do because we're seeing that they're getting where they should. An example, a child is born at 7 pounds should double their birth weight by 6 months. They should be 14 pounds. Now, what if they're not? What if they're 10 pounds? Well, we need to look at number one, let's look at nutrition. What are they eating? And then if that is okay, then we need to start looking at things like growth hormones and thyroid hormones, et cetera, to make sure that everything the child needs to grow is there. Well, let's look at it. That 7-pound child at 6 months is now 20 pounds. So now we're really overweight. Well, we're probably being overfed, but don't think that's totally true. Sometimes it is hormonal. So you can see these are clues and hints to things that we can do. And the earlier that we intervene with this stuff, the better it is for the child, okay? So we know that milestones are done. So as I said, doubles the weight at 6 months, triples the weight by birth. They should lift their head by 2 to 3 months, roll completely over by 6 months. They should sit unsupported by 8 months. Now, they should be maybe taking a step by 12 months. Now, it doesn't mean that all kids are doing the same thing at the same months, right? But as long as they're turning over by 6 months, they're not walking by 12 months, or at least they're standing and attempting, that's okay. As long as they're moving in the right direction. For instance, my little Christian, he never walked at 12 months. He ran at 15 months, never walked. So there are things to think about, okay? So, as nurses, our job is to be able to let them know things that they need to do, how to meet their levels, what games to do, what things can help with, whether it's, mobility or fine motor skills or gross motor skills, all of these things. And it all needs to be on the developmental level of the child, right? We give a kid, an infant, a sticker as encouragement. The infant's going to take it and put it in its mouth, and it doesn't mean anything. But you give a Spider-Man sticker to a 3-year-old boy, he's going to be really happy and do whatever you want, right? So again, it should be on age appropriate, okay? Now, as we are looking at these children, and let's say we've given them things and clues in order to better their development, we need to go back and look at it. Is it being done? Is the kid now walking? At 12 months, they weren't really walking, but now the kid is 16 months and look, they're running. So seeing and following up. I mean, we know that's part of the ADPI, right? The last thing we always do is evaluate. Now, development goes from the head to the toe. The other word is cephalocaudal. What does it mean? What's the first thing we do? We lift our head, neck control, right? And then by the end of the infancy, 12 months, toe, we should at least be standing or walking or attempting to, right? Proximal distal is we start with everything here close to us. And then we start being able to go around to our periphery, right? Distally around. So from midline, now we're starting to be able to see things and work with things around us. And that starts as the infant or a neonate, which is up to ages 28 days. And then it becomes infant up to age 1. Our bodies are growing. All of our body systems are growing. I've talked height and weight, right? Metabolic rate, respiratory. Well, what is a normal heart rate for a brand new infant? 140 to 160 at rest, at sleep. You're like, wow, that's really high. Well, why do you need to know that? Well, what if you had an infant who's been vomiting and diarrhea and you want to check for fluid balance? You need to know a heart rate, right? Because if their volume depleted, the heart rate would be elevated. Well, if their heart rate was 160, does that mean there's a problem? No. At 200, it would be a problem at rest, right? Or a temperature. So or try to give digoxin. What's a heart rate to give for digoxin, right? So understanding the differences. Heart rates are elevated more. Respiratory rates, 40 to 60 at birth. Us adults, what, 12 to 20, right? That's what the textbook says. So understanding those can help you assess a child a lot better. We know that their immune system is only what mom gives them at birth. And then we know that we're giving them immunizations, hepatitis B, the first one at the hospital we give. And then it's at 2 months, 4 months, 6 months, 12 months, 15 months, 18 months, 2 years, right? We are giving because we're trying for that baby to be able to protect themselves. We know their kidneys are not fully functioning at birth. And as they get bigger, they do. Their nervous system, the way that they see things. Nervous system has to do with things like using hands. At first, what do? Well, mommy puts the hand inside the crib, puts the finger out, and the mom puts the finger out, and the baby holds it in a reflex grasp, right? It's a reflex. And then it comes into, oh, there's that finger and they grab it themselves. And that's more of a voluntary. So it starts out with very premature type of development, and then it works up into being better, more and more, okay? And then sleeping. They sleep a lot at birth, and as they get older, it's less and less and less. As I said, as we're looking at children, it's the height and the weight. We know that there are these standardized forms and we plot the graphs. Remember, as long as they're going in the right directions, not every child is the same. We're just evaluating the child upon itself, not upon brothers and sisters or anything like that. Brothers and sisters are usually different from them. There are some differences between boys and girls, just to let you know, there's a different growth chart for each of them. We know we don't see differences really until all of a sudden in adolescence, the boys get taller than girls, right? And up to that point, the girls are taller. We know that the first 6 years of life, this child is learning how to be involved in the environment, how to be with other people. I mean, infants, how do they first get into looking at and calling? You know, they're crying, parents come, and that little coo, they're learning that parents love that, and it gets attention from them. We know the Denver Developmental Screening Test has nothing to do with intelligence, okay? Very important concept here. Nothing to do with intelligence. It's just saying, is the child performing those developmental tasks at a level that's appropriate for them? It has nothing to do with how smart they are. It's not an IQ, okay? We know that there are things that do affect their growth and development, their hereditary, their nationality, their race. Where are they in the family? A firstborn might be less than the middle one because the older kids are teaching the middle child, right? Boys and girls are different. And then the environment. Are they in an environment where there's learning? Are they in an environment, you know, that parents are working so much that they can't spend the time teaching and showing these children stuff? I mean, you know, that's life. These are all things that will affect it. You know, the function of the family is really important, and it helps the child to be able to deal with life because they're going to see what is the family doing. They're going to do things about the same. You know, what about a child who is homeless? You know, I've seen it, and it does affect their growth and development. Well, number one, are they eating correctly? I mean, they're homeless. That means probably financially. You know, if they're lucky, they'll get a hamburger to share. Are they having fresh fruits and vegetables and all the things nutritionally? So that's something that we need to think about. Are they getting proper hygiene? Are they getting clean clothes? Are they sleeping right? This is a really big thing in children because they need, you know, to sleep. They need, you know, cleanliness, and they need nutrition, nutrition. Number one thing they need. So, as nurses, what does that mean to us? Well, if you know that you see a family that's struggling, homeless, you know, I would call in a consult, tell a physician, and get social worker, some financial aid, something to help them. Some of these families, they could be, you know, I live in South Florida. There's a few Mexican migrant workers down here, and some of them are afraid of being deported, you know, and they don't have money, but there are things available to these people. So they won't ask themselves. That's part of the culture. They won't. So these families do have things in order to get proper medical care, maybe get housing, et cetera, et cetera. So think about these things. I've referred, I can't even tell you how many people I've gotten help for many different things from. We know that behavior is all a part of things that come from the family and the interaction with everything around them. So if they're just at home, it's the family. If they're home in school, all these things do reflect upon their behaviors and personalities, right? So theorists, now I'm going to warn you. The first exam has 6 or 7 questions on theorists. Many of them are on Erikson, Kohlberg, Piaget, and Maslow. So if you don't know them, it's something to look at more. I did send you an extra PowerPoint, but even your first exam, I have a handout for you that's really good. There's a PowerPoint and then just a handout that you go through it and fill it in, which will help you with these things. And I know they're confusing. Let's just try to figure out how it is that you need to understand. Now, from birth, what is a child's job? Well, they gotta just react and be able to deal with the environment that they're in, right? They need to know how they can get food, or when they're need mom and dad, how do they get them? They also know that the responses by the family towards the child is going to be how personality is made. If you have a child who cries and nobody goes to feed them, change them, this is going to be an angry child, right? So all of these things make a difference. From birth, we should encourage that child to be touched, held, fed, whatever by the parents. You know, many children, newborns born, a lot of them, of course, as nurses you meet, they have medical problems, right? Those medical problems make it sometimes difficult for parents to hold their child. So I would do things like have them brush the hair or put little socks on or putting bows or, helping me clean the bedsides. All of these little things get that bonding going on. Very important that we do it from the beginning. And that little, involuntary reflex grasp that that child will do to that mother is usually, it really helps that parent. A child's job is to develop trust. This is all about Erikson, right? Trust versus mistrust. And trust, what does that mean? That means that if they're hungry, they'll be fed. If they're tired, they'll sleep. If they have a dirty diaper, they'll be changed. And that's basic for a child who is about trust, okay? The one thing that, this is talked about, do not let grandparents take over parental tasks. So as I said, my grandson, for the first couple of years, lived with me. I was so careful not to try to control that infant. I let my daughter make the decisions. I would ask her how much she wanted to be fed, what she wanted me to feed, what everything, because it's not my job to raise the child, it's hers. And I was just there to assist. And as being a pediatric instructor, a pediatric nurse, it was difficult, but it can be done. And, it's something my daughter actually even thanks me with even today, okay? Children, toddlers. Now, toddlers are what sort of children? These are kids that are like a blender with the lid off and turn it on. They're everywhere all at once, right? They're in here, under there, around there, getting into things they shouldn't be getting into. And that's what we call autonomy. And this is Erikson again. Ever hear of being autonomous, doing things for yourself? Well, that's what a toddler wants to do. Now, there's something called where we as parents, grandparents, say to these children, no, I'm sorry, be careful. Don't do that, don't do this, you can't do this, be careful, look at that, you're gonna trip, and doing things for the child that the child needs to do. And that brings on inferiority, right? They want to do it, but they can't. So as a toddler, we really need to let them do as much as they want. I mean, I call toddlers my dive bomb kids. How many toddlers, age 2, on top of a couch, jumping from one couch to another couch, to this pillow on the floor, to here, to there, is just part of their learning, right? Now, preschooler, again, Erickson is initiative. Initiative is they want to do things and they want to please, they want to help, right? Now, the thing about that is we don't, again, need to do it for them. We need to give them the independence. We need to let them have that opportunity, and that makes them feel good. Again, Erickson, school age, ages 6 to 12, is called industry. And I don't know why they use the word industry, but industry is something they do well. So in school age, what did I do well? Oh, I was a great speller. I was great at math, and I got, rewards for that. People would say things, but I couldn't do, let me say, geography or science or whatever. I couldn't do that well. Oh, my handwriting was horrible. And that made me feel that is that inferiority side. So the thing about school age children, they want to do something well all the time, but they can't. So it does give them frustrated. It keeps them frustrated. The thing about why do we want to know that? Let's say you have a kid in the hospital a long time and you want to do something that stimulates them. Maybe give them a puzzle, to do something to do during the day, right? They're there. Maybe it's something they have to be there for a month, and you've got to keep these kids' mind going besides just homework or whatever or TV. So you give them a puzzle. Don't give them one with 1,000 pieces to it. They're going to fail, right? And you don't want that. That industry would be upset. But if you had one with maybe 250 pieces that were bigger, and the pattern wasn't like all the same, that's something that they could accomplish. And that's why we learn it, that industry is something that they can accomplish. It's going to take a little work, but they can accomplish it. Children, especially your school age children, they need to know their own limits. And they do try to please. School age children like to please, people in authority. Okay. So, and they do please because, again, they want that recognition for doing those good things. Now, adolescents are now children who think they're grown up and they start being risk takers and they want to figure out who are they? Who am I? It's all about body image, looking good, whether it's the hairstyle, the makeup, the clothes, the shoes, the nails, whatever. They want to look good. So they're establishing physical identity. The next thing, sexually, who am I? Do I like girls? Do I like boys? Then going on into future, what do I want to be when I grow up? Right? These are all things adolescents are going through, and it is a whirlwind of emotions. Okay. One of the things that I learned being a grandparent with a child here, my husband is Jamaican. His values are a little different culturally. And he would let Christian do a lot of things that it's just easier to do it for him, right? Sometimes it's easier to do it for the child than it is for them to give them the time to do it. The thing is, you need to let them do it. They need to try. That gives them a sense of accomplishment, of industry, right? Or whatever age. They need to understand. And then as we get to be adolescents, again, we need to sit back and try to let them do the right thing. It doesn't mean you let them, but being there as a guide, and just trying to guide them through this time of life. We know kids want to be good and they want to be accomplished and they want to be recognized. Now, Piaget is all about cognition. Now, cognition is thinking, and they build upon it. I'll give you an example. So, we started out with that reflex grasp, right? And then we go on to a voluntary, they grasp. What about that first time they take a rattle and they grasp it voluntarily? And they have it in their hand, they make a movement suddenly, and they hear this noise and they like it. So they shake it and they hear it. They go, ooh. So next time they get the rattle, they're not just going to hold it, they're going to get it to shake it. So now they've taken that grasp and now they're making a noise with it and they like it. Then what do they do with everything? In the mouth, right? How do infants explore the world? Through their mouths. So they grow through it. It goes into even further. So the kid's sitting in the high chair. Mom goes in the kitchen for whatever. The child doesn't see mom. The child wants the mom to be there. They take the sippy cup and throw it on the floor. What does mom do? She comes there to pick up the sippy cup, right? So they start to learn. They're getting smarter, smarter, and smarter. And that goes the sensory motor to the pre-operational concrete operations. And then it ends up with your adolescence. How many of you, as adolescents or have adolescent children, that you've told them, no, you can't go to the movies on Saturday night with your friends because whatever. And all of a sudden that adolescent does all of these things that they know that you like and do it without being asked because, please, mom, let me go to the movies. They've figured out 10 different ways because their goal is to get to the movies. And usually in the end, the mother will say, okay, you've done all this great. You got an A on your test. You made your bed. You took the garbage out, whatever. Adolescents are smart. That's formal operations. As I say, they can fight their way out of a paper bag and they will get out of it. Sequential, again, this is all part of Piaget's and learning. Again, building on one task and making it into more is just part of what he says. So teaching children, excuse me, and teaching parents. Now, it's not that we teach parents for them to do things. It's to see that the kids are going to be doing that. So again, finding ways for parents to be able to do that is, important. And again, whatever we're doing in the area of teaching, remember it's on a level of understanding. And that means to the parent or unto the child, okay? Now, nutrition, nutrition, nutrition. We know that if you don't put gas in the car, it's not going to go anywhere, right? You don't put good nutrition into an infant, into a child, their brains are not going to work. And cognitively, they're going to be delayed. I mean, this is why we do height and weight. I've said this already. Now, we know culturally, there are some cultures that don't eat meat, don't eat pork, don't eat something. And just think about iron deficient anemias and diet on that vegetarian. Needs to be a way that we teach them how they can still get what they need within their culture. It's modifying that, right? Because we want children, to have the best fuel for their body to be the best that they can be. We know if they're too big, there's many things we can do. We can do all sorts of diaries, look at it, and again, these quote, modifying these eating habits, quote, diets, shouldn't be called diets. I mean, there needs to be something in there that the kid looks forward to. You don't just take away everything and become very strict. Kids won't follow that for sure. We do not restrict fat from children up to at least age 2. And the reason is you need that for your central nervous system to think, okay? The only thing we would do is cut down calories. If we're giving kid apple juice, we'll say, all right, just give them water, as, extra liquid, okay? So there's ways we can do it. Underfeeding. If you see a kid who's underfeeding, well, I've already told you, these kids are not going to be as cognitively aware. Now, you're going to see these other symptoms. They'll be restless. When a kid's hungry, what do? They cry, right? And again, failure to gain weight. I mean, that's your obvious. But cognitively, you're going to see a bunch of growth and developmental delays. Absolutely. Overfeeding, well, they're going to be too big, too much weight gain, and then you're going to see that little throw up going on, and you're going to see some diarrhea on them. So you can see it either way. And I think the biggest one here again is those weights, right? When you think of fat, remember it causes gas, all right? Just think of fat. If you eat too much, you're going to be gas. And it causes your stomach doesn't empty good, but that's abdominal distension and gas, and it's pain. And you can see carbohydrates also have that flatus in there too. And then constipation could be from too much fat or protein. And they don't have any of the bulk, the vegetables, the fruits, etc. Whole milk should never be introduced till 1 year. And I didn't say low fat. Again, you give regular milk, even if they're a little overweight, you're not going to take the fat away. Fat's important for their central nervous system development, cognition, okay? So whole milk is at 1 year. Children should be able to feed themselves by about the end of the 2nd year. It might be with a spoon upside down, a fork backwards. It might be with only their fingers. My 6-year-old grandson still likes using his fingers, loves cucumbers and lettuce, and he'll just sit there and pick it up. I'm like, can you use your fork? With ranch dressing dripping down him. But again, they should be able to feed themselves. Now, one of the things that happens with parents is because you're always on a time crunch. Yeah, I mean, everybody's busy, right? You as students want to get the kid fed so that you can give them bath time, put them to sleep so you can do homework. And you're trying to rush them. And what happens is you'll end up feeding them. And they need the opportunity again to do it themselves. Kids love stuff with their fingers, right? It starts out, it used to be little Cheerios, but now we got those cute little puffs that they love to puff. They start out with what we call a crude pincer grasp, which means their fingers sort of smush. As they get older, it's that forefinger and thumb, and they take one at a time, right? And this is again part of making fine motor development and doing well with it. Okay, be careful with these finger foods. Not all of them are good. It needs to be a good variety again. We know that kids don't like food many of the times. Younger kids, they don't understand how horrible some of that stuff tastes or that formula tastes. There's some formulas called Nutramigen. It's like the easiest on the belly. If you look at it, it looks like grease on the top, but on the bottom, you have to shake it up if you smell it. And these kids, they think it's great. But as the kid gets older, their taste buds get different. They taste things better. So, of course, they're going to like the sugar and the good stuff, right? But you got to be very careful about giving them those empty calories and that they get all the foods that they do need. We know that kids who don't eat right, they're not going to have the energy that they should. They need it well-rounded. And we know kids just give me McDonald's, right? They want a Happy Meal, chicken nuggets and French fries, apple juice, right? Or chicken nuggets and macaroni and cheese is your toddler's apple juice is the big thing that they like there, right? So we know that children are getting more and more overweight than they used to. A lot of it has to do with all of these pre-processed foods that are out there. And we know that we have to be very careful. I mean, here is your formula for your BMI. Just remember, kids that are overweight can become adolescents and adults with problems with cholesterol, diabetes, and blood pressure, just to let you know. So we try not to do that to our children. Many kids don't want to eat for whatever reason. It could be, again, parents only feed them 3 different choices, but always think about, is there something in the mouth? Sometimes they have a sore in the mouth or they have a tooth. Making sure as that other person looking in that it's not something like that that's impairing their ability to eat, okay? Because it could be just as simple as a tooth that needs to come out. They should have 1 tablespoon of food per each age of life. It's not a lot, is it? We think they need all of this food, but they really don't. 1 tablespoon of food. They should not be having all of these drinks, like giving Christian a glass of apple juice before he eats will be guaranteed he's not going to eat his dinner or lunch or breakfast that well. So we're not going to give it to after, right? And if they want something to drink during, it should be water so that they do get the proper nutrition. Another thing that we forget, for good, proper growth and development, some infants are born or have sometimes where they're unable to eat. Maybe they're born, they don't have a connection between their mouth and their stomach. There is a blockage there. They can't eat, but they still need that pacifier. It's for growth, development, and what do children do with their mouth, infant? They're self-soothing. They decrease their own stress. They explore the world through their mouth. They take away their own stress by sucking on a pacifier. So pacifiers are very, very important. And through my career, I've seen it go back and forth and back and forth. But I know children with a pacifier calm themselves down. Baby teeth should be started at 6 months. Should be 1 tooth per month at 6 months. My kids never got teeth till 15 months, and then they got 8. So as long as you can see they're sort of maybe, you're doing okay. When they come in, we should be brushing them. No toothpaste, just water, just a soft toothbrush to keep them good and clean. Because remember, a tooth that's rotten, decayed, can cause them not wanting to eat, right? Snack foods, cheese, milk, sugarless gum for your older kids. Raw vegetables are good, okay? And making sure, again, they brush, especially before bedtime's the best. That bottom picture there is a bottle mouth. And I want to tell you a true story. My oldest son had bottle mouth. Back then, they didn't have those sippy cups out yet. And he liked apple juice. And he would hold his bottle, the nipple, in his mouth, and he'd swing it around and walk around the house with it. And before I knew it, his front teeth were dark and black, bottle mouth, due to the apple juice. Today, those sippy cups, you can't do that. And then, of course, we're told, please brush your child's teeth, even with a warm rag, warm water and a washcloth, and just make sure that they are clean before bedtime. They tell you in the book and through all the literature, fever has nothing to do with teething. Although every time my kids teethed, they had a fever. So I'm not going there. I'm not going to argue it. You should replace the toothbrush after they're sick. How many of you get sick and don't change your toothbrush? You could get sick again. It's something that I have extra toothbrushes all over this house because of that. Because if you're sick, throw it out, get a new one. It's better a new toothbrush than it is going back to the doctor, right? And you shouldn't be hot watering these bristles either, because it can make them, the integrity can loosen it. Play, play, play. Children love to play, right? What do they do all their life? They play. So we know that hospitals do have playrooms, which is great, especially that child is there for long periods of time. I know at the area hospital where I worked, it was a great one. There was an open area that was open to air. There's checkerboards. They used to do painting, pool, bowling, I mean, all different things up there. And what does play do? Well, play allows the child to express themselves. I mean, give a kid a crayon and a piece of paper, and he will do or she will do something, right? And they love computers today. I mean, my 6-year-old grandson knows how to use my phone better than I do because he'll just, oh, you go like this, Nana. Boom, boom, boom. I'm like, okay. Make sure what you're picking out for children is appropriate to their age, very important. And remember things like stuffed animals with asthma children, that fluff in the air could create a problem. We know that there's all problems that can affect the teeth due to whether it's the medication. Again, with all of these things, make sure that we do good dental care, they see the dentist, and that we do brush their teeth. Now, infants, ages 0 to 12 months old. So, what is normal? Well, they sleep, they wake up, they eat, they play a little, they go to sleep. This social smile, they coo, right? And they cry when they want you. And they're going to start to be able to drink from a cup. Separation anxiety. This is when the child needs to go to daycare and you give your child, your baby, to the caregiver, and that baby turns around with his arms back at you and cries. And it's called separation anxiety. And all younger children go through it. They just want who they know is familiar. After they get to know people, they're better. But I think that first week when you send them to daycare is really, really hard. When you have a child that all of a sudden slows down on development, as in they're turning over, but they're not sitting up and it's 11 months old, there's a problem. Make sure, again, that we tell the physician so we can get them evaluated. So, what is normal for an infant? I've just went over a lot. I told you 140 to 160 at birth, but look at 1 year already. 100 to about 120. Again, sucking is how they self-soothe, it's comfort. Children love to be held, bounced. You know, they love, again, they have that pacifier when they can't eat. And, you know, they love to use their hands as they get older, something to hold on, you know, having the rattle there or something for them to go for it. As we start, we're going to start with that voluntary, the reflex grasp, to the voluntary, to crude pincer, to fine crude pincer, and then the fine motor goes on to say putting blocks, pulling them out of a box. You take toys out, and then a building blocks of 2, you know, a stack of 2 is that fine motor or fingers, F for fingers, that they should be doing by 1 year. Now, children, when you turn them around to place them into a crib on their bellies, you're going to see this parachute reflex. It's they put their hands and their feet out, and it's a protection thing. And it usually comes about 7 to 9 months. So if they fall, they're protecting their heads, basically. Schedules, consistency, routine really, really help. If they're crying, pick them up. If they're always crying, we know that they're going to go through that mistrust, okay? Let the children attempt to do things. You know, if they're not doing it, come back tomorrow, the next day, try again. And if a child does something good, it's like, yay! You know, the normal stuff that we do. Making sure we're doing stuff developmentally appropriate, sensory stimulation, taking care of kids that are crying, hungry. You know, sometimes just picking up, holding them, and rocking them is what they need. Know that no two kids will ever be the same, even twins. Doesn't matter. Identical twins. They're going to do all things differently. And remember, these children go through this slow, quick change during that first year, okay? And it does progress in one way. The nurse, our job is to help parents, help them what they need to understand. You know, when we're looking at parents, when they're working with their children, holding their children, different little tricks, especially if there's medical conditions, we can help that way. Children, they're all different, just like adults, we're all different. You know, they all, act differently with different things. So just to know that when we approach children, start on their developmental level, down on their level. Don't tower over children, even infants. Get them on that level and then very easily work your way into touching them and preventing lights from going in and noises, etc. When you have a child who is that irritable child, that kid needs quiet. That kid needs slow movements, does not need to be, moved around quickly. Loud voices doesn't make it better. So you sit with them quietly. Have it a very soft voice. They love to be put up in their blanket and wrapped snugly. It gives them comfort. And of course, that pacifier, self-soothing, right? Colic. I think a kid with colic is one of the most difficult for parents because 24 hours a day, these kids are crying because of gas pains. If the kid is fine, but the kid cries, 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 cries. Usually these kids will outgrow that, by about 6 months, but those first couple of months, parents not sleeping, the kid's not sleeping. So again, we're going to treat them very similar to that irritable child, that lethargic child, making sure that we do things very quietly and slowly. Sleep intervals, again, putting them on a routine is the best we can be. Remember, today it is recommended to be on their backs to go to sleep, not on their tummies. Again, self-soothing, give them a pacifier, show them what they need to do, or show them where their finger is, because once they learn it, they'll remember it. Children should be going in for their health checks. I mean, they're getting their immunizations 2 months, 4 months, 6 months, 12 months. So, I mean, they're going in quite a bit, but making sure that they're checked, that they're looked at, that looking at developmental levels, because the sooner that we introduce early intervention, the quicker these children will catch up to what they're doing. Preventing illness, again, it's all about things that we would do for an adult, same thing, making sure that we're looking at hearing and vision, any screening tests for children. Again, that height and weight every visit, making sure they're getting immunizations, that they're eating properly, and that parents have all the education they need to take care of their kids. Again, kids with special needs, again, early intervention will catch most of these children up. And it could be all different sort of therapies that they need. There's all different sort of resource groups on the internet and within hospitals. You'll see a bunch of different parental groups that also can help, okay? Remember, immunizations are there to prevent some really diseases that are very difficult, making sure that they have those records and understand why. Feeding, nutrition, nutrition, nutrition. Now, for the first 6 months, we should only be given breast milk or iron fortified formula. After 6 months, they say sometimes a little earlier, but usually by 6 months is when we start to introduce food one at a time, 4 to 7 days apart. And we're looking for allergies. Children can have allergies to almost anything. And an allergy could be Colic, gas, diarrhea, vomiting, rash, could be a lot of things. So a change in a child's something could tell you that's what's going on. Now, we don't feed before 6 months because their gastrointestinal tract is very immature. And if you feed them, you know what you'll see? The food in their stools as it comes out. You'll see pieces of whatever. So they're not getting nutritional value from that. One thing that happens now, these babies are used to sucking, swallowing, and breathing. That's all they do for the first 6 months to eat. And all of a sudden, we're sticking a spoon in their mouth. And you're going to see what we call a tongue excrusion, which is this. You give them food and they stick their tongue out. It's not they're saying, I don't like it. It's a reflex. And then after a while, it will start to go back in and they'll start eating right. And they start going up and down, munching type thing. So that's what tongue excrusion is. So parents do need to be taught about nutrition and what's important. Remember, culture makes a big deal with this. I mean, for instance, in South Florida, they want to give their children black beans, one of their first foods. It's fine with me as long as it's mushed up good enough. But remember, it has a lot of spice in it too. So I would tell them to make it more simple, more bland. But remember, culture is big. And this is what the parents believe in. And those values do go to those children. So again, how do we know that a child is eating right? Well, at birth, you send the child home, and if you're breastfeeding, you're like, I don't know if they get enough. Well, yes, you do. If a child is having four, uh, well, six to eight, but usually they say the number 6 wet diapers, whether stool or urine in it or both, they're getting enough food in them. Okay. It's enough liquid that's going in there. Also, remember, what are we doing for the first 6 months? They're in there at 2 weeks for checkup after they're out of the hospital. Then they're there at 2 months, 4 months, 6 months. So they're being seen very regularly for immunizations, and we're weighing them. And we're going to see, are they gaining weight? At 6 months, have they doubled their birth weight? And then the other thing, are they sleeping? A child whose tummy's full is going to sleep. A child who's hungry is not going to as much, right? Again, cow's milk is only given after 1 year of age, not before, because it doesn't have all the things in it that a child needs, okay? So human milk for the first 6 months or iron fortified formula, and then we can add on milk at 1 year old. Now, prebiotics, probiotics, this is something that is given to children. Um, you have an infant who comes in having diarrhea. Now, you still need to feed them liquid because it's not the food that's creating it. It's probably something in their tummy. And what we do is we just give some probiotics and it treats diarrhea. And that's what you'll be taught. If you go into a hospital, your baby has diarrhea. All right, continue feeding them and add probiotics. Once the stool firms up, you can stop the probiotic. Very easy. Another thing, if we're giving formula, always check expiration dates. Don't leave the formula sitting out. Make sure those containers are clean, all of that stuff. If a formula is sitting out and you feed it to them, that's how they can get sick. It's like, would you eat milk? If you had it outside overnight on the counter, then would you drink it? No. Well, we don't want that for your infant. If an infant is sick, we never introduce anything new, especially food. Now, the first food that is normally given as a first food is rice cereal. It is the easiest on the tummy. And many times we give rice cereal if a child has reflux. They have that little spit up because that little rice cereal will thicken and hold down that milk. Okay. Now, earlier than 6 months, you're going to see it in the stool, but the milk is going and staying down, and that's what you want them to stay down. You should never mix the cereal in the food in the bottle. The only time is that when they're newborns, young infants with reflux. We would put it there only because they are spitting up, okay? But normally, you're not going to put stuff in a bottle for them to eat that way. We want you to spoon feed these children. You should delay things. And, let me tell you, they are changing all the time, their beliefs and what and when to give. But orange juice, fish, nuts, strawberries, chocolate, and egg whites should be held on till later on because there are high incidence of allergies of them. Whenever you feed a child, start foods, it should be the food before the milk. And then after the food, you can give them their bottle of milk, okay? Children need a lot of calories, but these, as long as we're feeding them, the way the physician says, the amount of ounces, a tablespoon of food per year. I mean, half a tablespoon is, for 6 months, right? That would be good enough for that. And again, remember, they can have fat until 2 years old. Do not stop that. Breastfeeding helps with a child's immune system. It should be given, but there's many parents who can't, or for whatever reason, it's just an impossibility. So again, using formula, don't overfeed, okay? And once they fall asleep, they're done. As long as their diapers are wet, you're doing good. As the baby gets older, the teeth are going to come in and they're going to start biting the nipple, which sometimes could be the mother. It's like, oh no, they got teeth now. I'm in trouble. And, it can hurt. Just know it's just part of it. And we know that, infants do still want to be held when they're feeding at this still young age. Be careful of foods and what's in them. Always read the food labels, okay? Again, food should also always be given before we give the milk. It's just like don't give apple juice before a child eats because he's going to be filled up on the apple juice, not food, right? So 4 to 6 months of age, you're going to give them food. They're going to be able to munch, no more of that extrusion going on there. Their sucking is getting better. Fruit juices can be started somewhere about that 6-month stage, but remember again, one new food at a time, and there are those foods to delay. Again, rice cereal should be the first one. Again, it's less allergies been shown across the board, so it does. It's a really good food to start with. Car seats, rear facing until the age of 2. Now, this is what had me confused with little Christian. At age 2, he was still 24 pounds. He's a peanut. He's 6 and he still weighs 45 pounds. He's still a peanut. But, you see this 30 to 60 when you should turn those seats around. Well, rear facing till age 2, because of their muscle maturity, they can turn around at age 2, even if they're not 30 pounds. And we checked with the pediatrician because of that. Remember to be careful of falling. Remember, a 6-month-old should be able to turn, so don't have them on a changing table, the couch, anywhere. They'll roll right off and onto the floor. Okay, so be careful with that. Always be careful. Safety, toys, little pieces, etc. Everything in their mouth. They explore the world from their mouth. So here we are with some of those major developmental changes. Weight doubles 6 months, triples by 1 year. The head and the chest at birth, the head is big. Got a big head at birth. Then all of a sudden, about 1.5, they become equal, and then the chest becomes bigger than the head after that. That was always a Hesse question. Maternal iron stores are going to be gone by 6 months. And that means those children need food with good iron supply, right? They're born with binocularity, which means this eye sees and this eye sees, but they don't see together, which means there's no depth perception. Somewhere about 9 months, those eyes now work together, and now we can reach in depth perception and get what I'm looking for. Okay. As I said, 4 to 6 months, they'll be able to roll over. By 1 year, they should take some steps. It starts out with being reflex type of movements, and then it becomes I'm aware and I'm moving voluntarily myself. As I said, teeth start coming out at 6 months. And now you're toddler. Toddler ages 1 to 3. Call him my dive bomb kid, right? These are children now who want to be more autonomous. They want to do for themselves. So I said, it's that blender with the lid off, turn it on, they're everywhere. They love to explore. So that's autonomy. That shame and doubt is when you're saying, oh, be careful, don't do this, let me do that for you. You're not giving them the ability to do those things. And that can be a problem for self-image, for they're feeling like they've done something wrong. Toddlers, no, 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 mine, 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 mine. They're egocentric. They're all about me and everything is mine. They're starting to learn how to act out in public. You're starting to see personalities, their behaviors. Toddlers love, love, love rituals, schedules, maintaining the same. I think toddlers are the hardest to take on vacation or have in a hospital because they don't know what's going on. They're confused and they're just stressed. They like the sameness of every day. That's what they know. Birth weight should quadruple about 2.5 years. We know that as they're getting older, they're getting longer and thinner. They're getting more muscle control. Their bowel and bladder start that training, right? 2.5 to 3 years old about. And remember, they're all different. I've seen 4-year-olds just finishing potty training. Remember, they're all different. Kids are all different. Again, respirations, still, you see the belly moving in and out, right? Temperature is good. Infants don't hold their temperature, but by the toddlers, they do. You're getting their teeth, the deciduous are complete. All their teeth are in by 2.5 years. They're becoming, immune system is better. Their digestive system, they're able to eat. They're doing 3 meals a day now, not every 4 hours eating. They're starting to be able to perform more independently, and that's what they want to do. They're able to be away from mom and dad a lot longer now. They're starting to understand that they're going away. They're understanding if they do something wrong, something's going to happen. Like, mommy told you not to put the finger in that plug how many times? And now she's yelling from across the room. Oh, I knew she'd do that, right? They're starting to copy things. They're starting now to understand things like when they move their bowels and they urinate in a toilet, when you flush the toilet, they think that part of them is being washed away. They're giving life to inanimate objects. It's just part of what they do. One of the things is children who have been scolded upon or yelled at for something, they still need to know that they're loved. You don't love me anymore. You'll hear that more as they get older, but the toddler feels that. They're starting to understand more that they can talk. So you could talk to a young child on their developmental level. they can't verbalize it, say those words, but they're understanding more than what they can speak, okay? They're also starting to get a little bit more of empathy. They're starting to, let's say, something happened, you go, ow, and you hurt something. They'll go over and kiss and say, all better, right? They're starting now to have at least, there's one word by 12 months. And then two words starts about 24 months. And it becomes more and more and more. Their language becomes more. Their social skills become more and more. And, you're always trying to rule out any sort of things that are going on. Autism is difficult to diagnose. They do not do it till about 2 years old. You might see clues before that, but autistic children are usually, they don't talk. They sit in the corner. And the one thing is, and they don't like people. The one thing that we need to do with these children is to rule out any sort of pathological reason, because things like lead poisoning, hearing problems, etc., those things can cause symptoms that look like autism. So we can't just say, oh, that child's autistic. We need to rule that out, okay? So these kids you don't punish, you need to teach. You need to give them a time out for doing an incorrect behavior, and it's 1 minute per year old, okay? But you don't have basically a punishment. If they have a temper tantrum, you need to walk away. And if they are, and you walk away only if these children are not going to be in risk of harm for themselves, because sometimes you need to intervene. But most of the time, they want to have a temper tantrum, okay, and just walk away. I mean, keep an eye on them, but walk away. Always try to be positive. Always try to give them that self-confidence, praise them for doing good things, putting that whatever in the garbage can, or putting their shoes where they belong, right? All of those little things they should be praised for. They're always afraid of being alone. Ever see a toddler? They do not want to be alone. They always want somebody next to them. And if they're not, you will be hearing them screaming. Again, children do not like when you're talking down to them. For instance, I worked the last 10 years of my career, I worked in an emergency room. And they were in rooms with a closed door. And I'd walk in and be a young toddler. I sit on a chair, pull up to the stretcher, and I would just start talking. Maybe I'm telling them, oh my goodness, you got big blue eyes. Or, oh, your sneakers got lights. They're pretty cool. Or, oh, I saw a Spider-Man t-shirt. I've got one of them too. Well, you've broken the ice. I'm on their level. And now I can do what I need to do for them, right? So get on their level, developmental level. And then these children, they'll be the greatest helper, but it has to be done. I mean, they should be able to get in and out of clothes. It may not be inside out, backwards, correct, but the attempt is being made. And of course, down here in Florida, sunburn is big, so we have to be careful. Making sure the shoes fit properly are really important. We tend to, get whatever shoes we can, but children, we should be measuring their feet. Good for that. Getting them on the toilet, actually, you will see bowel training is quicker than urine training. They can feel the stool coming, and then making it fun. Putting a potty chair, they say that bladder training can start when you start seeing periods of time where you see a dry diaper, and that usually will help you there. And you're going to see different words that are used. Again, nutrition. Toddlers are picky eaters. Again, 1 tablespoon of solid food per age. Again, making sure they get their milk in there and that it's tiny little pieces of stuff. These kids have their own thing. Some of them don't like mush, some don't like hard texture. These are things that we need to work with these children. Daycare is difficult, but we have to do it. We have to work, right? We have a life. Making sure that putting them in a daycare that's appropriate for your child. We know that toddlers got a very short attention span, and the one play they do is what we call parallel play. These are kids playing with their own toys next to each other, and they're not playing together. And toddlers need close supervision, okay? Children that are toddlers, you need to let them go. You need to let them try. Don't hold them back. They need to explore. They're curious. They're mobile. And then injury prevention, again, they can sit in a front-facing car seat, again, still in the back. We're going to still use things like the sleepwear, caps on medicine. I think the one thing they love to get in is Flintstone vitamins. And then making sure that they are in, if we're using the crib, that it's up and car seat placed properly, et cetera, et cetera. Toys, if they're the right age for their child. No little pieces. Again, this helps them explore the world and everything, okay? It's what we call child-proofing. And as I said before, it's egocentric thinking. If there's a toy in that daycare that kid wants, he's going to go grab it, mine. And if somebody else wants it, it's going to be a fight. And that's just part of being toddlers. So that was your first set of PowerPoints, quite extensive, a lot of stuff, but some really good information. So we're going to do our Kahoots and then we'll be out of here. Have you ever done a Kahoots before? Go on your cell phones and go to kahoot.it. And in kahoot.it, or you can take and use that code there. Take a picture of it and go that way on your cell phones. So again, remember, next week is going to be number 1, a quiz. Number 2 will be our PowerPoint. Number 3 will be our Kahoots. And again, if there's any extra time, maybe I'll even introduce a little bit of dosage calc, or we'll do a case study. We'll see what we need and what you would like me to do, okay? All right, let's get going for today so we get out here at a decent time, just like I promised you.
How do we do this?
Kahoot.it, and then you put in the number at the bottom. The nurse explains that permanent teeth begin erupting at what age? Your internet, I can't hear. The pin is 1869192. Permanent teeth. So we talked about baby teeth is 6 months, right? At 6 years old is when you see this. Now you're going to see me put questions in, some from next week, some from this week. I'm trying to open your mind and showing you the differences here, because we already know 6 months is the first ones. What age is considered infancy? Who's ever talking? I can't hear. It sounds like a robot. So infancy, from 0 to 28 days is neonate, and from 0 to 1 year is called an infancy. Okay, so that's why it's 4 weeks to 1 year, because the first 28 days is going to be your neonatal, or your baby's called a neonate. A mother's concerned that her second born is not reaching milestones as quickly as their first child. What should the nurse say? So, as I said, kids are all different. Nobody's the same. As long as they're moving in the forward direction of development, that's all we want to see. They will not be the same, even identicals. What food might cause botulism if given to an infant? This is something that is given that I've heard, whether it is, they give it for constipation a lot of times. And it's something that culturally it is, but it should never be given to anyone less than 2 years old. And it's honey or that light or dark Karo syrup, because we don't know if it's pasteurized, we don't know how old it is, and it could cause botulism, which is an extremely dangerous thing for any age person. What characteristic of physical development best describes the development of an 8-month-old? What should an 8-month-old be able to do? 8 months old, a child should be able to sit unsupported. That is according to the book. Some of them are 6 months doing it, but it should about that age. Which milestone would the nurse be most concerned with a 12-month-old infant during a well child checkup? What are you looking for at 12 months? What should you be able to do? Well, we know a 12-month-old should at least be standing, attempting some steps. So if they can't pull themselves up and, like, what we call creep, like around the couch, there's a problem. So, and if they're not even sitting, there's a problem. So what would we do? That would be early intervention, putting them physical, occupational therapy and seeing what's going on and seeing if there's any other reason why that's not occurring. A multi. What technique should be used to soothe the irritable infant? You have a kid who's irritable, always crying. This is a kid that you're going to no sudden movements, very slow, calm voice, the pacifier. Absolutely. And we're going to swaddle them really nice. Okay. We're not going to change the position frequently. And we're going to do it infrequently, but very slowly. Okay. And rocking would be a very slow, easy. Everything slows down here. A parachute reflex and usually appears in an infant at what months? Mm. We talked about that, putting them in on the crib on their abdomen, and you'll see their hands and their feet come up, right? They're protecting their heads. And it's right about 9 months, okay? That's the 9-month stage. Parents of a 2-year-old child report that he is inconsistent and frequently says no, 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 no. Mine, 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 mine. What do you think about that? It's a toddler. Is that normal? Or do we need to do something? And that's absolutely what a toddler does. It's all about the egocentric thing. They're all about me, me, mine, 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 and everything's negative. And it's absolutely normal. Every toddler goes through it. At what month do toddlers usually recognize sexual differences? When children are very young, they don't know boys or girls or anything to do with it. And about 2 years old, they're starting to notice that mommy sits down and daddy stands up, right? And that's those differences they're starting to see. Very subtle, but they start to notice. What is the cause of most childhood deaths? And it's accidents. Accidents are something that happens. It's like motor vehicle, believe it or not, is the most common cause of deaths in children. It's something that, we don't try to do, but accidents do happen. And the literature, all of it from infant up to adults, motor vehicle is the #1 cause. According to Erickson, what is the correct stage of development for the toddler? What did I tell you about toddlers? So they're autonomous, they're egotistical. It's all about, I want to do it myself, right? So that's autonomy. And then the shame versus doubt is mom and dad and grandma saying, no, 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 be careful, don't do that. Let me do it for you. And that creates the shame and the doubt. What guidelines should parents of a toddler follow when feeding solid food? Toddlers ages 1 to 3. What do you know about feeding? And they're saying solid food, which means not just milk. It's all about 1 tablespoon of food per year of age. And you're thinking, well, that's not much. I mean, toddlers really don't need a lot because they're not gaining weight a lot. They're not getting tall as much. That first year, they need a lot more. But after that, it's 1 tablespoon of food per year of age. Which type of play is typical during the initial toddler years? I mentioned it in the end. And it's called parallel play. Now, there's different sort of plays, and you need to understand them. But toddler, parallel. This kid's playing here, the other kid's playing here, different toys by themselves, but they're next to each other. They're parallel to each other. A multi. Which characteristics are displayed when a child experiences separation anxiety? You have one question, discussion questions, which are going to go into all of those levels of separation anxiety. Children don't want to be away from their parents. We know that. And everything here is protest, screaming, yelling when they leave. And then all of a sudden, despair, how they are sitting there and they regress. And then the mother finally gets back after having to leave for, let's say, a day because they had to work or whatever. And now they don't want anything to do with mommy. That is those stages of separation anxiety. What is the most important nursing intervention to promote a positive hospital experience for a 1-month-old infant? You think 1 month they don't need certain things. I'm telling you, infants are smarter and more aware than you understand. And what we'll have to do is they like familiarity, just like they like mom and dad. That provision of constant caregivers is most important. After that, what I would say is provision of consistent sensory motor stimulation. How do they self soothe? How do they seek the world and see the world all through their mouth? So, first of all, your caregivers, and then give her something that orally they can work with. What are the best foods for the nurse to recommend for a 2-year-old diagnosed with mild constipation? So you have a toddler, it's a little constipated. We do not give enemas. We do not give laxatives for a child who's mildly constipated. We try to do it more homeopathic, and that would be increasing the fiber, shredded wheat and cooked prunes, and actually raw vegetables, not cooked if we were going to add them in there. A group of children are observed playing house, each assigned a specific role, mommy, daddy, or child. At what age do you think this would happen? Remember playing house when you were a kid? No, this is your preschoolers, ages about 3 to 5. 7 to 10, they're not going to be playing house. They're going to be doing a board game or something else. That's more of your preschooler, ages 3 to 5. For how many weeks will the infant experience passive immunity from his or her mother? That means mommy gave me all this good stuff. How long is it going to last? And that's about 12 weeks, 3 months. That's why what are we doing? 2 months, 4 months, 6 months, we're giving immunizations, right? That's why we're always going to wash our hands around infants. A multi. Which characteristics are present in a well nourished child? We're going to see things that look good: shiny hair, regular elimination, protruding abdomen. No, that'd be more someone had too much fat in their diet, right? That's that gas. A newborn infant will typically lose blank to what percent of his or her birth weight by day 3 or 4? Babies are floating in water, right? Amniotic fluid. And that soaks up and it's in their skin. And initially, they're going to lose a certain amount of weight and then start gaining weight really quickly. And that's about 10%, 5 to 10%. And it's absolutely normal. What does self-feeding help to develop in the toddler? Remember I say that usually happens by about age 2? I mean, it doesn't matter if the spoon or fork is upside down and backwards, or they're only using fingers, they're feeding themselves. That's the important thing. And that is your sense of independence. Remember, toddlers, me, egocentric, I want to do, right? Why is the 4-year-old child likely to obey rules? Why? This child now does these things because they don't want to be punished. They know that if they do something, they won't be punished. They want to get all the good stuff. They like the rewards. What is the earliest age at which an infant is able to sit steadily alone? You know this one now. And that's your 8 months. Good. What is an abnormal finding in an evaluation of a 6-month-old? So remember, we start with lifting their head, turning front to back, back to front, getting up on our knees, sitting up, sitting. Then we start with creeping, crawling, creeping, and walking in the first year of life. So if at 6 months my head is not coming up when I pull them up, something's wrong. They should have head control by 3 months, the latest. How many hours should toddler be able to stay dry for the nurse to suggest that they are ready to begin bladder training? Remember I told you periods, long periods of time where they don't soil their diapers, that it's dry. You're like, okay, they're starting not just to constantly be dribbling, right? Because that's what they do. And that's about 2 hours long. 3's a little bit too long. How many minutes should a 5-year-old be in a timeout? And it's 1 minute per age. It is 5. What type of family consists of 2 parents with children from a previous relationship? Remember, there's all sorts of families, and a family is whatever they say it is. 2 women, 2 men, a mother, a grandmother, and that's called blended. Very good. An infant who weighs 6 pounds, 12 ounces at birth should weigh what at 6 months? Giving you a math question pretty quick, huh? And they should double, which is 13.8 pounds. Very good. Last question. What is an example of proximal distal development? Proximal distal development. What is that? It's going to be the arms and the hands. It's not head control before trunk control. Remember, it starts here and then it starts working out, and then we start using the hands. Okay, let's see how we did today. Number 3, Ryan. Good job, Ryan. Number 2, Erica. Number 1, Mimi. 4, Essay and a Think. All right, that's all I have for today's class. Jacqueline, are you there, or are you just turned me off? I see your camera is off on me. Jacqueline, are you there? Ms. Jackson, okay, there you are. Good. I didn't see anybody. Okay, that's the end of the class today. I'm going to send you the recording. I will be sending you the PowerPoint there with it. And I'm going to be sending you some of your math stuff. Remember, go over, look at it, and when you need it, let me get with me and we'll figure out a time so I can help you do the best you can at your math, okay? Thank you, everybody. Have a great
you.
evening. Have a nice weekend.